Welcome to Financials with Ahau. It's a joy to be together with you as we continue on the Making Wealth series, and our focus is reflections on retirement. We've been building up on this conversation, just covering different things. What does it mean to retire? What age do you determine retirement for you? And just trying to brainstorm and open our minds to what retirement could be and what retirement could mean, and how do we plan our finances around that area. One of the things that really came to mind is healthcare. When it comes to a time of retirement or a time we're not actively in the workforce as we are, we've grown older, how do we plan for our healthcare in that time? And it's not one of the places where you quickly want to go to, because when you think of healthcare, many cultures are still averse to thinking about the end of life. So it's like, okay, I'm not so sure I want to think about that direction, but it's not necessarily that. It's actually planning or instituting what will be able to make sure you're taken care of as you get to that older age or that time when you're not in an active income the way you were before. And there are many things to think through, like many governments are trying to institute some form of medical care that will cover those who are older. Probably the governments are the ones that only do that. But then there's also the private sector, which is trying to come up with this kind of plans. And they're not the most cheap, but they are things we can plan for and ensure that we can be able to access. So it's really that place of sitting down and telling ourselves, I'm going to have a time that I'm older, I'm not actively earning the way I was. How am I going to ensure that financially there is something to care for my health? Does it mean that I probably will have certain assets when I'm younger that are held in a more solid form, but as I get older, I look at how I'm going to liquidate those assets, making sure that there is funds available for different things in terms of care that I may need? Is it thinking through plans and places where I can put money that will easily be accessible? Quite a number of things to reflect about. Recently, I was having a conversation with an older person, and they had asked me to look up for them a certain company that is doing like a group thing where you contribute a certain amount and then they will support your family in the event that you've passed away, and where there is healthcare needed, they're also present to support you in that way. And I remember us looking through the premiums, and given that they're over 70, their premiums were the highest. And they were like, oh my goodness, is there not another offer? We know, how else can I go about this? But it's because of just that timeline, and you're starting this when you're way, way, way older. So the cost of doing it is definitely going to be higher. But we have the capacity to think through it now, to plan through it now, to ask ourselves, what would I like my healthcare plan to look like as I'm getting older? Do I want to have a custodian of a certain amount of funds that can be accessed if and when I need that level of care? It's a place I invite us to continue to think about, to pray about, to continue to research and write. Write what you discover, then you can see your options and make an informed decision as you continue to prepare for those years that are coming ahead. Thank you for listening. It's a how. It's been a joy to be in conversation with you. God bless you. Until next time.